This is Mike Dilt with the Relax Back UK show on UK Health Radio, your global real feel-good radio station. On the Relax Back UK show, we explore all kinds of health topics, so keep listening and enjoy the ride. Hi, and thank you for joining me, Mike Dilt, with the Relax Back UK show. This week, the show is made possible by the kind sponsorship of Alga Cells. Alga Cells uses the body's own stem cells' ability to regenerate tissue to treat joint and spine injuries and pain. Check out their website, algacells.com. I hope to be doing a few shows on various aspects of cancer, and there was a recent one where I spoke to cancer research scientists. Today's show looks at a wonder drug for cancer. However, it is one that has been around for a while.
It's now internationally recognised by roundtables of experts all over the world that exercise should be the first drug we give cancer patients. From the day of diagnosis, all the way through treatment, all the way through metastatic cancer, it improves. It's proven to reduce the risk of recurrence by half.
This is Liz O'Riordan. She's a breast surgeon who got breast cancer herself. And I was lucky enough to talk to her and Professor Greg Whyte, a modern pentathlon Olympian and also a sports scientist. These are two fantastic guests who really advocate for exercise. Well, for many things, but certainly as part of cancer treatment and also cancer avoidance in the first place. So please do stay and listen to them.
This show is cool!
The station that makes you feel good.
Nagging pain. We at Alga Cells know that a small amount of the patient's own bone marrow and blood cells can treat many painful conditions with regenerative orthopedic therapy. This is an attractive treatment option for painful joints, back pain, sports injuries and many other conditions. It may avoid the need for surgery altogether. Alga Cells, part of a network of 50 RegenX clinics worldwide where over 60,000 patients have been treated and helped. Alga Cells. Life is more beautiful with less pain.
A cancer diagnosis can be scary and stressful for everyone involved. Hello Love is a contemporary living space and well-being center in central London where anyone can come and learn about illness prevention and non-toxic practice. Inside, you will find a vegan restaurant, juice bar, and holistic dojo that encourage lifestyle changes to help heal mind, body, and spirit connection. Cancer patients are offered free sessions. To find out more, please visit us at hellolove.org.
UK Health Radio, the station that makes you feel good.
Liz O'Riordan is a breast surgeon who got breast cancer herself, and Professor Greg Whyte is an Olympian and now an academic, and they both join me to talk about exercise and cancer. Now, they've both been on the show before, so the first thing I did was thank them for coming back.
Great to be here. Thanks for having us back on.
Yeah, thanks, Mike.
I've always enjoyed talking to you guys. And since you're both the sort of people that kind of exhaust me just looking at what you get up to. You've both done many things, but let me just pick on a couple of things that involve swimming. So, and I'll pick on Liz first. I know you started cold water swimming.
That's right.
Yeah. What brought that on?
So it's finding a way to meet people. And I live in the middle of Suffolk, and I thought I'd have to drive hours to get to the sea to swim. But I found a group on Facebook called the Blue Tits who swim all over the world. And I found there are a load of little rivers and lakes I can go swimming in. And there's something amazing about being in cold water. And I've heard people talk about it, and I didn't get it. I always get really ill if I don't have a wetsuit on. But just being in that water and that high, and it's really good for my scarring and my pain as well, just being in that cold water. So I'm now hooked. Okay. I'm going to try and keep going for as long as I can through the winter.
Excellent. All right. Well, that might be potential for another show there, because I've heard lots of people talking about that. And Greg, you've done you swam the length of the Thames.
Yeah, yeah. It was an interesting one, really, because it was sort of born of the fact of two issues which we probably don't want to go into, but one is around drowning prevention, which is very dear to my heart, and the role of Royal Life Saving Society, and the fact that actually one person drowns every 20 hours here in the UK.
It's awful, isn't it?
It is. I mean, just despite
that's a terrible statistic.
Yeah, I mean we're an island nation. We've got 5,000 miles of coastline, 4,000 miles of inland waterways. And really, the sort of the push to do the challenge and actually raise awareness was actually born of the fact that although it is a requirement and a national curriculum requirement that year 6 children, so 11-year-olds, should leave school able to swim. This year, over 2 million children left school unable to swim. Now, when
my goodness!
You add on top of that the imminent. Well, over 400 swimming pools have already closed in the UK. The imminent closure of predicted to be 3,000 swimming pools by 2030. And really we're standing on the precipice of an absolute disaster when it comes to drowning. And so really the challenge, I mean, I swam the length of the Thames, 125 miles, a little bit extreme, but was to actually raise awareness for that and actually raise money for the Royal Life Saving Society and the RNLI.
Right.
Two things really. One is about learning to swim, but actually water safety education is so important, just so people understand, and Liz talking about going into cold water, understanding the mechanisms of cold water exposure and what's going to happen and how you respond. Absolutely crucial to survival and enjoyment.
I don't swim alone. I have a tow float. I make sure people know where I am. I'm really sensible. I acclimatise. But people are just going and jumping in really cold water without a clue, and it is dangerous.
Yeah, absolutely.
Goodness. All right, let's park that. Potentially, again, a topic for another time, maybe. What I'm hoping to pick your brains about generally is the topic of cancer and exercise. Both exercise once diagnosis has been made, and you're a patient, but also in the realms of prevention and sort of do fitter people get less cancer. Now, a while ago, Greg sent me a paper, and it was written a while ago, 2017. I must admit, reading scientific papers, I don't find that easy, but it came out with some pretty big statements, which I try not to sort of cherry pick and just quote them out of context. But the sort of things it was said, in colorectal cancer, a 50% increase in physical activity after diagnosis decreases the risk of the cancer death and indeed all death. And there was another one that I picked out as well. If women with breast cancer, if they exercise for 30 minutes for 5 times or more a week, they have a lower risk of death. So that's from a paper that's a few sort of years old now. But are those kind of statements now taken as a really established truths a few years on?
Yes.
So you're both nodding your heads.
They are.
What have you got to say about that?
Do you want to go first, Liz?
Yes.
Okay, so it's now internationally recognised by roundtables of experts all over the world that exercise should be the first drug we give cancer patients. From the day of diagnosis, all the way through treatment, all the way through metastatic cancer, it improves. It's proven to reduce the risk of recurrence by half for the big cancers. And that's only because we have enough people with big cancers to do a trial on. There aren't enough people with anal cancer to do this, but it should work for everybody. It halves the risk of recurrence, and it's free. It improves the mental and physical side effects of chemotherapy, surgery, radiotherapy, plus it protects your bone health. It is the wonder drug, but it's hard work. And it's not a magic bullet, and it's not as easy as taking a tablet, but the evidence is there.
Okay. I must admit, I wasn't expecting such an answer of yes, it absolutely does. Because so I'm not really in this world, but, this idea has sort of it gone over my head. I didn't realise that, one of the if you're diagnosed with cancer, one of the first things that your doctor might say to you, certainly in the UK, is do some exercise, go for a walk. But is that the reality?
It's not happening at the moment. No. And I think, so as a doctor, you get so little time to go on courses for study leave. And as a breast surgeon, I was only learning how to treat breast cancer. I didn't know all about this evidence for exercise. And most health professionals won't know. And it's how we filter it through from the exercise oncologists to reach patients and their team. I never told people to exercise. I didn't know it was a thing. I just did it because I liked it.
Right. Okay.
And a lot of and as an aside, I had one lecture at medical school about exercise. I wouldn't know how to teach a healthy person to exercise, let alone someone with cancer and COPD and a stoma. So most doctors say just go for a gentle walk, don't hurt yourself. Because if you haven't had chemo, you don't understand what someone is capable of.
Yeah, of course. All right. Well, so maybe the next question should be, fitness and exercise in this context. What does it actually mean? Is it, strength, how fat you are, lung capacity? What is fitness? Or what should patients be striving for then?
Well, do you know, all the above, Mike, is the answer to that. I mean, fitness is made up of a whole host of different components, but to some extent, the easier way of looking at it is activities of daily living. So, for anybody listening to this, just think to yourself, the physical activity you do through a day. So from climbing a set of stairs, what do you require to climb up a set of stairs? We need strength, endurance, and aerobic capacity. And that aerobic capacity requires the heart, the blood, and the lungs integrated to enable you to achieve that. If you think about going shopping, you've got to carry heavy bags, or if you've got grandchildren or children, you have to pick those children and grandchildren up. That requires strength. To do it, if you're anything like my kids, you have to do it multiple times. Strength endurance is important to that. Washing the car, doing the gardening. Just think about activities of daily living, what's required for that. And I think what's interesting is that the data shows really nicely that outside of everything else, if you exercise pre, during, and post cancer, what returns and what improves is functional, what we call functional capacity. So actually that ability to operate around activities of daily living, they simply become easier, and so therefore more enjoyable, and therefore you do more of them, and so therefore you're more active from it. So it's a self-fulfilling hypothesis.
Yeah.
Okay, so just keep doing your normal stuff. Don't sit down and let the medicine work, which some people, that might be what people feel they ought to do.
And it can be.
Go on.
It can be really hard during treatment. You feel sorry for yourself. You've got chemo. You think you should sit on the sofa, but actually, getting up and going for a walk every day, you can kind of tick that off, and then you can spend the time feeling miserable. But it's a form of mindfulness and getting out of your head and forgetting what's going on. And I think the strength training is almost more important than the aerobic after cancer. You get a lot of muscle loss if you're not eating well. And doing squats when you're waiting for the kettle to boil, doing calf raises while you're brushing your teeth. These are little things that you can fit like exercise snacks throughout the day. So it just becomes part of normal life rather than I have to go and join a gym.
Yeah.
Right, okay. No, perfect.
I think just on that, Mike, I mean, it is an interesting one, because I think that the sort of pervasive dogma is that actually, when you're undergoing treatment, this is generally sort of in healthcare, is rest. You must rest. Rest is really important. Well, rest is important.
Wrong.
But what you've got to try and do is balance that against a profound deconditioning. So if you become completely inactive, what then starts to happen, it becomes counterproductive. So what we know about, so if we think about chemotherapy, for example, but actually most therapies, whether it's hormonal or radiotherapy, are relatively toxic. So we have this toxicity. And one of those impacts, as Liz articulates beautifully, is that actually muscle mass is significantly affected. We get this process called cachexia. So we get a significant reduction in muscle mass. And of course, with that, we get a reduction in strength, a reduction in power. Activities of daily living become much more difficult. Now, firstly, what you have to think about is that if we can at least reduce that reduction. So by being inactive, what we do is we exacerbate the problem. So effectively, with the toxicity of the chemotherapy, we add on inactivity, and now we've got this double whammy. So what we're not talking about is, becoming Arnold Schwarzenegger, but what we are trying to do is offset that toxicity, so that at least what we can do is maintain muscle mass or reduce the rate of loss of that muscle mass. And the same is true for cardiac toxicity, that we're trying to offset that. Some beautiful studies from a good friend of mine, Mark Haikowski in Canada, showing the reversal of cardiac toxicity just simply with exercise intervention. So what we're trying to do is, to some extent, we're trying to treat the treatment. If you look at it in that way, is that we're being treated for cancer. What we don't want to do is move to a position where what we call comorbidities, other diseases, become as problematic, if not more problematic. So things like obesity, for example, type 2 diabetes, metabolic disease, all of those things which we know are related to inactivity.
Yeah.
The big problem is that we're being treated for cancer, we're getting better from cancer, but what we're now doing is we're causing other diseases, which then will have a profound effect on life.
Right. So really,
they used to say chemo aged you biologically by 10 years, but by doing exercise and staying active, you can reverse that. So you come out of it as healthy as you were when you went in.
Okay. So really, it seems what you're saying is exercise and keeping active during treatment helps with the side effects of some of these, pretty strong drugs that you have to take. All right. Yes. Okay. It's more dealing with the side effects rather than actually doing something that stops the cancer spreading.
But it does both. So we know that exercise independently reduces the risk of cancer recurrence by up to 50% for breast, colon, lung, prostate. As well as that, it also improves the side effects. And we still don't know exactly how it happens, because you kind of get a load of people and some exercise and some don't. Everyone wants to know, but is it mitochondria or is it this? So it doesn't matter. We know it works. You need to do it. That's the hard bit, Greg, isn't it? Why does exercise work? I don't know, but it does. Please do it.
I mean, and I think what's interesting is that to some extent, if you compartmentalize it, what we're talking about, the prevention of cancer, exercise is intimately involved in the prevention of cancer. Add on top of that, if you have cancer, it is incredibly valuable during the treatment of cancer. Add on top of that, post-cancer in terms of cancer survivorship, which includes recurrence of cancer. We know that there are very positive impact of exercise during that process. So, this is not just one point along this pathway of cancer. It's actually at every point along the pathway where increasing physical activity, being active, can have a positive impact.
Okay. So I was hoping to ask you this question, which Liz, you just said no one knows, but
Greg might, but
Greg might. Okay, yeah. So actually, doing exercise or keeping up your daily routine when you're going through treatment, how can that possibly stop or slow down cancer spreading? It's caused by bad cancer cells multiplying, tumours getting bigger, or tumours cropping up in other parts of your body. I tell you a thought I had. So this is a layman's thought. If blood is pumping around your body because you're doing exercise, is maybe cancer cells more likely to spread about? You're shaking your head. Good.
Well, it's an interesting one, Mike, because I would say that when I started in this field, and we started our first studies looking at this, and interestingly enough, one of the first studies that we did was a PhD student of mine looked at breast cancer sufferers and looked at what's called contralateral breast cancer. So if you have breast cancer in one breast, the likelihood is that there is a high.
It's a higher risk of getting on the other side.
In the other side, whereas actually, when you intervene with exercise, what you do is you reduce that risk of contralateral breast cancer. I think, and this was some time ago, and since then we've done a whole host of different stuff in different cancers with different interventions, etc. I think probably the mechanism is where we know least, but certainly it's around a whole host of factors, and that is that cancer. What we know is that we can accelerate cancer, and we can accelerate cancer through environmental factors. So, for example, things like smoking, pollution, we know will accelerate it. Add on top of that there are sort of internal factors which will accelerate it. So things like obesity, for example, in particular, things that cause chronic inflammation can accelerate cancer and the growth of cancer. And so I think when we're looking at mechanisms, what we look at are those things which can affect things like chronic inflammation, or those things which will suppress immune function, those things that accelerate growth factors. Things like metabolic and sex hormones have a key role to play. Now, that's interesting because a lot of these things are interrelated. So, for example, with adiposity, so obesity causes metabolic and sex hormone changes. It changes growth factors, it impacts on immunological function. and it causes chronic inflammation. So there are some disorders which we know can lead to increased risk of cancer. So obesity is a very good example of that. And we sort of bang on about obesity, but obesity is really important because of, as well as metabolic disease, cardiovascular disease, cardiopulmonary disease, cancer is intimately linked with obesity.
Okay.
So,
and that's actually not out there in the public domain as much, is it? I don't think.
It's a hard message to get across.
Yeah.
And it's not just being overweight. There are lots of things linked to it, and it's really hard to get the message out without obsessing people, if that makes sense.
Yeah, no, I can imagine. Sorry, Greg, I kind of cut you off in mid-flow.
No, but for sure. So I think that, but the interesting one is that, counter to that, when we spoke about the early work that we did, I would say the one pushback I got on a continual basis was, if you increase blood flow, if you get the heart rate up and increase blood flow, what that will do is accelerate the growth of tumours. And in fact, what we know is that tumours are almost entirely anaerobic. They're avascular. They don't have a vascular system. And interestingly enough, so our most recent study and some studies that we're now currently doing to look at this, why does exercise make a difference during treatment, particularly chemotherapy, is that what we know is that tumours produce huge amounts of lactate. And it's what's called the Warburg effect. And one of the things that we're really interested in is actually the role of exercise in countering that huge production of lactate in multiple different ways, and whether that has an impact on the efficacy, on the way in which the chemotherapy functions.
All right.
So I think to some extent that there's lots of that sort of classic pushback. If we exercise, we increase blood flow, and so therefore the tumor grows. It is almost entirely erroneous.
Okay. And so it's like most people who are having cancer treatment have surgery pretty quickly, so they don't have cancer anymore. We assume there may be dormant cells in the bloodstream that may wake up and find a friend in years to come. But actually, if you've had surgery, you don't have cancer. The treatments are done to stop it coming back, and exercise improves all of that. Okay. And if you think, well, exercise is improving the blood flow to the cancer, these couple of cells, but it's also improving it to your muscles and your bone and your heart. So by not exercising, you're damaging your body, the whole of you. You can't decide to not get blood to the cancer cells. So it's improving you and your general health. So you reduce the risk of those cancer cells coming back in the future.
Yeah.
People imagine you've got a big...
Yeah. And of course, whilst we don't really fully understand the mechanism, but what we do know is that actually exercise is anti-inflammatory.
Yes.
So actually what we're doing is we're creating an environment where we're less likely to propagate the growth of cancer. It is anti-obesogenic in a sense that actually combined with controlled calorie intake, and actually that we can talk about. Let's not talk about diet and nutrition, but anyway, combined with all those factors, what we are doing is we're creating a better environment which limits or reduces the risk of cancer developing.
I get it. I had another man in the street thought as well. If you're taking drugs which are designed to prevent tumor growth or knock out tumor growth, and you're exercising and blood is pumping around your body, maybe you're going to deliver more drug to that tumor. Another man in the street thought, for which I probably should apologise.
I think we're talking little tiny.
Either one of you.
I think you're talking little tiny cells. So if you're having chemotherapy, you want the cells to be growing really quickly because they kill every cell that grows, and the tumor grows more quickly. So if exercise may help keep them going, so chemo can stop it. But the body just doesn't work like that. Everything gets the same amount of blood, the same amount of sugar, the same amount of fat. You can't pinpoint. It's like you can't shift fat off your tummy. You lose fat where it comes off.
Okay. Yeah. All right. No, that's fine for that. Thank you.
I think that, that's the interesting thing about chemotherapy. I think is that it is its whole system. It's ubiquitous. It's everywhere. It's not target.
It affects all of you.
There's some really and there's some really interesting work going on currently with things like hormonal therapy and which are more targeted.
Yeah.
But we're still a fair way away from this idea. The interesting thing about something like radiotherapy, for example, actually is very specific and very targeted, but equally still has peripheral effects.
Mm-hmm.
But I think the future of cancer therapy, to some extent, is actually around very specific, highly targeted therapies, which don't lead to this change in the whole body.
Let me just ask a question a bit more personal, actually, because Liz, when you were undergoing treatment, you did a triathlon. Is that right?
I did. Yes.
Okay. So what brought that on, and did you kind of instantly feel better? Tell us a bit about your experience.
I swam at school, but I did no sport. As a doctor, I had no time, and I became a cycling widow. And I thought, if I don't cycle, I'll never see my husband. And then I wanted something for me. And I did my first triathlon a couple of months before I was diagnosed. I was cycling at mountains in Italy. And then I thought, no one told me to exercise during treatment. It wasn't a thing. This is 2015. And I wanted to, because it was me. I didn't have cancer when I was exercising. So I didn't tell my team. I had a port in so I could swim in a pool. And I did the local cycling club sprint triathlon very, very, very slowly. And I had to promise them that if I felt sick, that I would stop, because they were terrified I'd get along the course. But that feeling of achievement, of crossing that finish line, thinking, wow, I have done this halfway through chemo, was just amazing. And I could do far more than I ever thought I could. And it's mind over matter. It's being sensible. It's thinking, no, I can do this. And I think when it comes to exercise, you've got marathon runners being told to walk for half an hour. And actually, they can do far more. And if you don't exercise yourself, you don't get what it feels like, how hard you can push yourself. And I think we need to change what cancer patients can and can't do. But for me, carrying on exercising through treatment, as well as knowing I had to do it, I was just Liz when I was exercising.
Right. So it really worked for you, your mind as well.
Yeah. And like with the 5K Your Way and parkruns and that community and just doing things with people, it's just incredible. You think, wow, I've achieved something today. Cancer doesn't need to stop you doing anything.
I think what's interesting in that, to support that, is that I think one of the most valuable interventions, certainly in my clinic, we work closely with the Lung Oncology Centre and their Living Well program, is actually using exercise as a target. I think, what's interesting, and, Liz can speak to this, but much of, certainly in the treatment of cancer, just about everything you do is negative.
Yes.
In the sense that chemotherapy, it makes you feel nauseous. It causes myalgia, so muscle pain, sleeplessness. All of these factors critically cancer-related fatigue, and that's an interesting one to talk about with exercise. But and radiotherapy is the same, and so basically everything is sort of negative, because of not necessarily it's positive, it's being treated, but the outcome of that treatment tends to be negative. And here we are with something. So one of the things that I work very closely with our guys, we actually move people to a 5K run to do the race for life. And all of a sudden now you're doing something that's almost continually positive, is that, it's good for you. I'm going to keep doing it. And I'm trying to reach this target. And people around you are sort of saying, oh my God, it's amazing what you're doing, even though you're having treatment. And that further buffers your mental and emotional well-being. And so I think it's the positivity of exercise,
and
which
a
is the
sense
real
of
value.
Everything is being done to you, but you can exercise. This is something you can do to help make yourself better.
Yeah, absolutely.
When you were a surgeon, Liz, and you were faced with patients, obviously, any sort of surgery is a big deal, and you've got to be in reasonable physical shape to kind of deal with it. Could you ever say, right, we're going to do surgery, but you've got to get a bit fitter first, or is there sort of no time for that? Time's of the essence. So whatever their physical state is, they're on the slab as soon as they can be.
So breast surgery is a bit different because it's kind of surface surgery. So you don't need to be fit to do it. And most people are done and go home the same day. I never told any of my patients to exercise because I didn't know it was a thing.
Sure.
And it was only when I was diagnosed myself and thinking, well, I thought I should be told this. And I realized the huge dichotomy between what I didn't know as a surgeon and what I needed as a patient. It just wasn't on my radar. It never has been. I think for a lot of people now, they're slowly being told to walk, but it's not, you've got to be doing the weights twice a week. You've got to be getting hot and sweaty with the cardio. You've got to push the body. What actually is exercise? And I'll put my hands up and say, I didn't know, and I'm sure half of my colleagues don't know about it. And that's a challenge for Greg and I to get that awareness up and out there.
Yeah, it sounds like there's a big job of work to be done to, because let's face it, medics aren't exactly twiddling their thumbs wanting to go on another course.
So I mean,
and it's it's how you safely prescribe exercise to someone who's going through a treatment when you don't have that knowledge, and how we get those professionals out there.
So I love it when we get to a point where we can talk about something that we've just currently done. Actually, we just launched it, and that is what we've developed over the past 3 years is a new register for what is called clinical exercise physiologists. It's just moved on to the RCCP register. And I'm now working closely with the NHS and government to build it in. Effectively, what we've done over decades now in sport and exercise science is develop people who understand exercise and exercise prescription. And certainly for me, since the late 90s, I've now moved that into clinical exercise physiology, so the prescription of exercise in clinical populations, which is incredibly broad. I mean, the interesting thing here is that exercise is a fantastic prevention treatment tool in all sorts of comorbidities. So from neural, so falls prevention in geriatrics, all the way through to cancer and cardiovascular and pulmonary diseases, etc. But the critical problem is always the fact that actually, almost unfairly, doctors were expected to do this, despite there being 0 hours of education on exercise and exercise prescription. There used to be that in physiotherapy. That has now gone. And so therefore the question was, we should be doing exercise, but who does this? So we've actually just recently launched it, and we're certainly working very hard to get these jobs in the healthcare sector, where you have trusted, highly qualified, accredited and monitored people who are prescribing exercise in clinical populations. I think we're sort of we're at the threshold where I think we'll really start to see things change now.
And there's also the Can Rehab Trust.
Can Rehab, yep.
So Anna Campbell trains physiotherapists and personal trainers to a level 4. So you can go to a gym and they can say, right, you've got a colostomy. You can't do this exercise, but this is how you work. So you can look for those as well.
Yeah. So, and interesting enough, Anna's part of the team that we've worked on for this clinical exercise physiology. So yeah.
So I went on she does a training camp with a load of Danish patients in Lanzarote. And there was this, I went along to watch. There was a 78-year-old guy who was mountain biking down a volcano a couple of weeks after surgery. And they say, there's no reason why you can't. Yep. And it's that flipping mindset of age is not a factor, illness is not a factor. You can do anything and you can enjoy it. And think, wow, I did that.
Yeah, absolutely right.
It sounds like there's a lot of progress to be made in changing mindsets and also getting people that can help people do this. This register that you mentioned, Greg, sounds like a very important thing, and will hopefully grow and get more recognised.
I mean, it will. To some extent, in some areas, it's been there for a very long time. So you think about cardiac rehabilitation. If you know anybody who's had a cardiac event, an MI, etc., the cardiac rehab's been around for decades. Equally with pulmonary rehab. Interesting enough, I worked during COVID. I worked with the Intensive Care Society on developing the framework for rehabilitation from intensive care post-COVID. So I think there is a growing understanding of the importance of physical activity in what we call rehabilitation. Yes, what we're now moving towards is the idea of prehabilitation. So our latest work in cancer, with esophageal cancer patients, we ran a big study at Thomas. What we were looking at there was prehabilitation. So in other words, getting people ready for intervention. So ready for chemotherapy, ready for surgery.
And
the
2
results
weeks can make a massive difference, can't they, Greg?
Incredible. I mean, just incredible. The results, we've published the first paper of that just recently. And the results, it's one of those, it's sort of a pinch me moment in terms of what we find from that. The profoundly positive impact that you can have with such a simple, cheap intervention is truly remarkable. It just makes things work better. The chemo works better. People recover from the surgery much quicker. They're in hospital for less time. From quality of life through to health economics, money saving. Exercise can have such a profound impact.
And just 2 or 3 weeks of it.
Okay, so after diagnosis, 2 or 3 weeks of exercise, and then the treatment starts. Is that and that fantastic? Okay.
The minute you're diagnosed, you should keep going. And why don't we have recumbent bikes in clinic waiting rooms? You spend so much time sat on your bum in a cancer clinic waiting to be seen, because we get 10 minutes, we need an hour to see patients. Why aren't there bikes? People can sit, recumbent bikes, start it there. Do your 10 minutes, raise money for charity, really, really simple.
What a great idea. I like that idea.
And actually, people who were sat on a spin bike during treatment for pancreatic cancer had a much better experience, because you spend 3 hours sat in a chair, but actually there's no reason why you couldn't be spinning your legs.
No. All right. It seems like when I'm talking to people, I do kind of specialize in asking impossible questions. So I don't see why you guys should be can get away with it. But does this idea of exercise, is there any evidence that it seems to work better with some cancers rather than others?
The simple answer to that one, Mike, I think, Liz probably answered this right at the very start, is I think that, with most of the research is in the big cancers. Equally, actually, there's not a huge amount of work in some of the big cancers like prostate cancer, but things like colon cancer and breast, etc. For multiple reasons. One is that actually you've got a much bigger cohort with which you can run research projects in what we call power. So you can power the studies large enough for them to be significant. I think the other thing actually is about money. Is that research money follows the big issues.
Yeah.
And so to some extent, it is most of our sort of the strongest evidence lies around the big cancers, things like colon and breast. But that said, I think sort of intuitively, I don't see there is any reason why it wouldn't run across cancers.
No.
Now, I think what you have to remember is there are different types of cancer. So blood cancer versus solid-based tumor cancers, etc., that may operate in a slightly different way, and exercise may have a different impact on that. But when we're talking about type of cancer, as it were, I think we can be fairly safe in suggesting that it will operate across all.
Yeah,
Okay.
I agree.
All right. And well, you touched on it then as far as availability of money and different types of cancer, but you're obviously working in research at the moment. But where is research happening now? Is it happening? Is enough happening?
Everywhere is the answer. I mean, it's probably the one hot topic. But having said that, it's incredibly complex because there are multiple cancers. Because we don't. When you're trying to identify the mechanism, what that means, you have to look at all the mechanisms and then titrate it down until you can pinpoint the certain mechanism. So therefore, what that means is that big studies that cost an awful lot of money.
And it's how you get people to only change the exercise part of their lifestyle. Because if people are changing their diet and this, then how do you prove it's just the exercise? So it's really, really hard for people to form habits for the length of the study.
And what an interesting one. So our most recent study, you have what's called case control. So you have a control arm. So in this study, what you've got is you've got a group of patients that you intervene with. So for us, we exercise them, and then we've got a group of patients that we don't exercise. Now, the problem with that is that we're here talking about the importance of exercise during cancer. You've only got to have somebody in that arm of no exercise who listens to a podcast like this and thinks, well, in that case, I'm going to start doing some exercise.
Yeah, because they've said it can halve my risk of recurrence, and I don't want to die. So it's
So what the messaging people get.
I mean, that throws up kind of ethical questions as well. Wrestling with that's going to be extremely difficult, really.
But in a way, it's good that we now think it's not safe to tell people not to exercise. So the message is coming through. So I'll take that as a positive, although it doesn't make Greg's life any easier.
But it is a very interesting point. Is that but that said, we've spoken incredibly positive about exercise on this podcast. I think we should always caveat that with the fact that actually there are in comparison to other areas of medicine and science, there are a relatively small number of studies in this area. There's an awful lot of work still to be done to really provide the evidence that we need.
Okay. I'd like to finish on a question for both of you, really. What advice would you give if someone has, just recently been diagnosed, or a member of their family, a loved one has been diagnosed with cancer, and they've been listening to this and thinking, oh my goodness, this is interesting. We need to get on board. What advice would you give? Where can they go for a bit of simple information to do the right sort of exercise at the right sort of time?
So the current guidelines state that you should do 30 minutes of aerobic exercise 3 times a week. And that means getting sweaty and a bit out of breath and a bit uncomfortable. And 2 half-an-hour resistance training sessions a week. So gym, bodyweight exercises. And it's hard to know what to do. Aerobic is anything that you like that gets your heart rate up. But there are 2 books I'd like to recommend that are brilliant, written by 2 experts in the field. So one is a book called Moving Through Cancer, by Professor Katie Schmitz, who's one of the world leaders on exercise oncology. And she talks about what to do with water bottles, resistance bands at home. You don't need to be in a gym. She has the science behind it. There's another book written by Carolyn Garrett called Getting Your Oomph Back Through Cancer, who again has case studies, people in a wheelchair, showing you what cardio you can do in a wheelchair, how to exercise at home with resistance bands. They've done the research. They are 2 great places to start.
Okay, that sounds like excellent advice. Anything to add, Greg? You're nodding your head there. So
absolutely. And I think, there is a plethora of information. I think, as with all these things, much like, we were speaking earlier on about, I've just written a book on exercise and pregnancy, is that it's quite an individual journey. And I think that what's really important is that you always interface with your healthcare professional,
yes.
healthcare providers, to ensure that and as Liz has already said, some really know an awful lot about it and actually can be really supportive. Others, but certainly what you will find is a community that will try and answer the question for you and provide the answers for you. And add on top of that they also know what you're doing. And I think that's really important, that what they can do is they can provide, because it's really very common that cancer is not the only comorbidity. It's not the only disease that cancer sufferers have. And so what you're trying to do is juggle this quite difficult balance between other diseases at the same time as trying to treat cancer. But I think to some extent, I would definitely say the future looks bright as we move forward. The new clinical exercise physiology register, I think the new understanding of the importance of exercise in cancer, I think as time goes on, I think we'll get much, much better at providing the right information for people so they can individualize their approach.
Okay.
I see one final thing. Sorry. So for people who are fit, who are athletes, who are used to training hard, who are listening, it's very easy to think, I'm going to carry on doing what I used to do. And you need to realize during chemo, the point is to kill the cancer, not for you to maintain your personal bests. So dial it back a bit. You may need 2 or 3 days to recover from a long session. This is kind of just base training of staying fit, not trying to train harder. Because I got into that, and you think, I'm not fast enough, I should do more, and then it just takes me a week to recover. So you do need to listen to your body.
All right, that sounds like excellent advice.
There's a little mantra I use with pregnancy as well, and that is maintenance, not improvement.
Yeah, that's it.
And I think if you keep that idea, then you're probably doing the right work.
All right. That sounds like a great place to finish on. It also has kind of left the door open for some more chats in the future, because this field is advancing. And also, Greg, you mentioned pregnancy and movement and a book you've just finished. Quick plug of that. Where can people get that? just before we finish. It'd be churlish of me not to let you mention that.
Well, listen, you can get it from all good bookshops. So if you're a bookshop and you haven't got it, you're not good.
Right.
No, it's called Bump It Up, and really what it does exactly what we've been speaking about here with cancer. It's evidence based. It really is providing the answer to some of those dogmas that we have across exercise in various different diseases, and it provides some guidance about what you should be doing, how you should be doing it, and interestingly enough, with pregnancy, much like it is with cancer, it's actually about pre-pregnancy, during pregnancy, and postnatal. It's the entire journey, which I think is important. We're not talking about just a very short snapshot of the process.
All right. I'm going to cut you off there. It sounds like it might be a topic for another show. But for this show, Liz and Greg, thank you very much indeed. I think that's going to be interesting and hopefully very helpful to an awful lot of people.
Thanks, Mike.
Yeah, absolute pleasure, Mike. Thanks for having us on, and it's been great to chat, Liz.
This show is cool.
UK Health Radio, the station that makes you feel good.
Nagging pain. We at Algacells know that a small amount of the patient's own bone marrow and blood cells can treat many painful conditions with regenerative orthopedic therapy. This is an attractive treatment option for painful joints, back pain, sports injuries and many other conditions. It may avoid the need for surgery altogether. Algacells, part of a network of 50 RegenX clinics worldwide where over 60,000 patients have been treated and helped. Algacells. Life is more beautiful with less pain.
A cancer diagnosis can be scary and stressful for everyone involved. Hello Love is a contemporary living space and well-being center in central London where anyone can come and learn about illness prevention and non-toxic practice. Inside, you will find a vegan restaurant, juice bar, and holistic dojo that encourage lifestyle changes to help heal mind, body, and spirit connection. Cancer patients are offered free sessions. To find out more, please visit us at hellolove.org.
UK Health Radio, the station that makes you feel good.
Big thank you to my guests on this week's show, and they were Liz O'Riordan, breast surgeon who got breast cancer herself, Professor Greg Whyte, Olympian and now academic, and thank you to you for listening, and of course a special thanks to the show sponsor Algacells, who bring regenerative orthopaedic medicine to the UK. See their website, algacells.com. If you or a loved one are in pain, do have a look. Thank you.
Was the Relax Back UK show with me, Mike Dill. Thank you for listening, and please do join us again next time.